Hello, my name is David Ryan James, and for my practice plan, I will be teaching the squat. This is for psychomotor development in children. So jumping right in, what is the squat? It was defined as a squat is a strength exercise in which the trainee lowers their hips from a standing position, then stands back up. During the descension, the squat, the hip and knee joint flexes, while the ankle joint dorsiflexes. Conversely, the hip and knee joints extend, while the ankle joint plantar flexes when standing up. That just means that they bend to maintain balance. So as outlined in the criteria, squatting in prepubescent children, equipment needed, it can be limited to just the trainer and trainee. Most often it will just be the trainer and trainee starting out for beginner level trainees. You can add more weight whenever they become more advanced, a little bit older. Things such as barbells, dumbbells, kettlebells, things like that, Smith machine, as they grow more comfortable. Also, you would likely have an object to simulate the lower extreme, such as a box or a chair, just so that they make that connection of where their lower limit is. So this is just a demonstration. You can see he goes all the way down using his arms as balance points, and then back up. Expected length of training, roughly 8 weeks in total. Warm-up and teaching fundamentals are vital because children do mimic a lot of what they are surrounded by. So week 1 and 3, teaching the basics in form, often using a chair and object as a bottom limit of the squat, just creating that bottom limit kind of criteria for them, helping them understand where their limits are. And then weeks 4 through 7 are more advanced, possible addition of weight if they are excelling in the training program. And then week 8 would be used for testing. So the testing criteria would be the full flexion of the knee and the hips to a 90-degree angle, able to maintain balance on the descent and ascension. The chest is kept up and the pressure kept on the heels of the feet as to support the knees on ascension. Do not put it at, you would correct it if they were putting more pressure on the balls of their feet, as this does kind of make balance a little bit harder. So in keeping that chest up, it also does help to kind of align everything, so it's a little bit easier on the spine and on all the muscles whenever you stand back up or ascension. Next, we're going into high school, squatting in teenage and young adults, that age group. So we'll hop right in. Equipment needed can be limited to the trainer and trainee, again, if they are kind of brand new to it, just kind of teaching everything, the fundamentals of everything. If they are more advanced, you can add weight, and then like barbells, Smith machines, anything in that realm. If they are a little bit more advanced, if they're a student athlete or anything like that, and they've kind of learned. With larger muscle mass due to puberty, more weight can be added, and then again you would use a box or a chair to simulate the lower extreme, things such as box squats. So demonstrations, more visual representations, trial and error needed, trial and correction. At this age, most of them are a little bit more stubborn. They like to do things on their own, so let them try it out and correct it from there. Show them visual representations and everything like that to form that mind-muscle connection, so that they can understand they're a little bit more advanced in their training. Time expected, usually about 10 weeks. This is kind of a stretch, but roughly to teach it thoroughly would be around 10 weeks. So warming up and stretching is vital, just because with puberty there's been a lot of changes in the body. So weeks 1 and 2 will be learning the techniques, no weight, no equipment, possibly a box or a chair just to show the lower level. Then weeks 3 through 5 would be the introduction of weighted equipment or assisted equipment such as a Smith machine to focus on the mind-muscle connection. 6 through 8 would be the correction of minor mistakes, fixing those minor mistakes, forming that connection again, and added weight. And then weeks 9 and 10 would be the possible baseline test for your strength, how much they can squat. Criteria would be hip rotation, flexion, knee flexion to a 90-degree parallel to the floor, extension, and then increased weight as training improves. So takeaways: after puberty, there is a need to relearn how to properly squat due to the body drastically changing. With increased muscle mass and body length, it creates a different leverage and pivot points, and learning is also more focused on kinesthetic as aging for squats, less of do as I say and more of watch me do and mimic. So thank you for tuning in.